Hello, today I will be talking to you about the use of ketamine for treatment-resistant depression. Ketamine is used clinically and recreationally. Some common trade names include Ketlar, Ketavet, and Betamine. These names mostly derive from its use in veterinary hospital settings. Some of its street names include Special K, and Cat Valium. Ketamine was first made in the 1960s to be used as an alternative anesthetic, especially on those in combat. Ketamine was a desired anesthetic because it produces dissociative anesthesia, where the patient might appear awake but they don't respond to sensory input, and their airway reflexes and respiratory drive are maintained. These effects are seen in high doses, higher than what I will be talking about today, but due to these effects and the safety profile, it quickly gained its initial popularity. Ketamine is made synthetically in a lab using a combination of chemicals specific to anesthetic effects. Ketamine at different doses produces various behavioral effects. However, when it is used clinically for treatment-resistant depression, specific changes are observed. In terms of behavioral and mood effects, ketamine reduces anxiety, depression, and pain. It also helps in reducing self-harm and suicidal ideations or behaviors. Ketamine can also lead to feelings of sedation, calmness, relaxation, and amnesia. Furthermore, there are some cognitive changes that can occur, such as distortion of sights and sounds, which can make the patient feel disconnected or not in control. It can also cause people to feel detached from pain in the environment. In a clinical setting, ketamine is most commonly delivered via IV administration. However, intranasal is another common route. Ketamine is able to be delivered in many more ways due to its water and lipid solubility, but these are not normally used for depression. The bioavailability is largely affected by the route of administration. Intranasal has a bioavailability of around 50%, whereas IV is 100. When used via intranasal administration, absorption occurs in the tissues. When used via IV, it is directly absorbed into the bloodstream. Ketamine is rapidly distributed into many tissues where blood flow is high, such as the brain, and it crosses the blood-brain barrier. Age, height, and body surface area can also affect the absorption of ketamine and how much is needed to get the desired effects. I did see that ketamine has low depot binding, but did not see much research about its effects on bioavailability and clinical use. Ketamine also has a pretty moderate half-life, between 2 to 4 hours, when used intravenously, but this varies between patients and route of administration. Ketamine can have a complicated metabolism, but to keep it simple, I'm going to go over the most common and research pathway. After IV treatment, ketamine is metabolized by cytochrome P450 liver enzymes, specifically CYP2B6 and CYP3A4. It is then turned into norketamine, which is further metabolized into DHK, or dehydronorketamine. Ketamine can be metabolized in other ways using the same cytochrome P450. Elimination of ketamine is primarily performed by the kidneys and excreted in the urine and bile. I did not see much on the connection between pharmacokinetics and behavioral effects, but I did see that age and repeated use can affect the metabolism and excretion. It can also change in patients with continual use of ketamine for treatment-resistant depression. Ketamine mechanisms of action are pretty complex. Ketamine is a non-competitive NMDA antagonist that acts by open channel block mechanism. This means that ketamine does not bind to closed NMD channels to antagonize them, but it requires channels to be depolarized and open, and then ketamine will antagonize. When ketamine antagonizes NMD receptors, it leads to inhibition, which causes the specific properties of memory loss, psychosensory effects, and the inability to feel pain. Ketamine also binds to mu, delta, and kappa opioid receptors. The binding to these receptors is associated with its antidepressant effects, as it acts on the reward system. Ketamine may initiate its effects through other mechanisms as well. However, this is less studied and more complex. Research has shown that ketamine is a positive reinforcing drug. It acts on the reward system, which causes functional changes in the brain. These effects are what cause the increase in dopamine follow ketamine use. People can show tolerance to ketamine. Over time, higher doses may be needed to elicit the wanted therapeutic effects, because over time, ketamine will increase the activity of CYP450, causing metabolism to occur faster. Ketamine doesn't show much evidence of physical dependence, but more of psychological dependence related to mood. Withdrawal tends to induce depression, anxiety, cravings, mood changes, and insomnia. Despite the controversy of physical dependence, treatment options are still available for those who use ketamine recreationally. Thank you.